Hello everyone. This is Miss B.A. Marvekar, working as Assistant Professor in the Department of Zoology, Rajarshi Chhatrapati Shahu College, Kolhapur. And in this video, we are going to discuss about one of the important disease, that is tuberculosis. This is the India TB report 2020 and it is indicating the best performing states or union territories under National TB Elimination Program in year 2019, and there are some few states out there which are performing very well, and even if we are performing very well, then also India is not totally became 100% free from the TB. Now, the causative agent of a TB is the bacteria, which is Mycobacterium tuberculosis. And this bacteria is having a rod-shaped structure. And if we will stain this bacteria with the staining technique of a Zill and Nielsen, then it will become the pinkish color in the structure, which is also referred as the acid-fast stain bacteria or acid-fast uh, bacteria. It is having a waxy coating of like a cell wall, which is made up of a mycolic acid, and it is obligate aerobes. That is to undergo the metabolic process. It has to depend upon the oxygen. Now, if this bacteria will enter in the body of the normal person, then the main region which get infected is the lungs. In the lungs, it will cause the formation of a hard nodule-like structure or cheese-like masses, which can be referred as a tubercle. This bacteria not only cause attack to the lungs, but it will also attack a part of a body such as kidney, spine, brain. And it is said that not everyone which is infected with this bacteria will become sick. So there are two TB related conditions exist in this world. One is a active TB and another is a latent TB. If not treated properly, so definitely the patient who is suffering from the TB will get fatal or it will get dead. Now we will study about latent TB. If we are suffering from the latent TB and it is said that if our immune system is strong, so we can fight this bacteria. And in case of a latent TB, there will be no any symptoms. And in that condition, if the patient is suffering from the latent TB, he is not a contagious to other. He will not spread the disease, even if the bacteria is alive in our body. So the doctor will give the medications to kill such a bacteria. But there surely in the future also we can, if our immune system will get collapse or it will get decreased, it may cause the conversion of a latent TB to the active TB. Now, if we are suffering from the active TB, then whatever germs are infected in our body, they will get multiply rapidly, and such a type of a patient can spread his disease to other one. So 90% of adult cases nowadays are referred as active cases of the TB. So these are the tubercles which are formed in the respiratory passage, especially in the lungs. And the main symptom or the early symptom of this disease is the coughing mucus or the fever. And if such symptom will continues for 2 to 3 weeks, so you have to consult with the doctor to check whether you are suffering from the TB or not. So these are the main symptoms along with the coughing. If cough lasts for more than 3 weeks, if there is a chest pain, if you are coughing up a blood, if you are feeling tired all the time, if there is a night sweat chills and the fever, and if there is a loss of appetite, if there is a loss of weight, then definitely you have to check for the TB. How it is spread? Suppose this is the person who is suffering from the TB. This is a TB patient, and this is the normal person. If this normal person accidentally or unknowingly come in contact with this person who is suffering from the active TB, then the tubercles are present in the lungs, which consist of the active bacteria. during sneezing and coughing action, if he will not take care to close his nose or the mouth with the help of a handkerchief, then during sneezing and coughing actions, the bacteria in the droplet forms will get spreaded into the air, and if such type of a air will get entered into the normal person, so definitely he will get infected with this bacteria. And it is noted that during after shaking the hands with such a person or sharing the food with such a person, you will not get the TB. So the World Health Organizations has decided to end TB strategy, and it has stated the strategy to there are certain targets for the TB elimination at global level by 2035. But our India has set its own target, and it has decided to decrease the TB patients at 20 to 25. With 17% of the world population, India contributes quarter of the TB cases of the world nowadays. So, what are the diagnostic tests which are performed to check the TB? The first two tests performed are the skin test and the blood test. Especially in the skin test, Mantax tuberculin test is performed, and sometimes it will also indicate the false positive or the false negative results. And the second test is the blood test, in which the interferon gamma release assay is performed. And if these two tests are showing the positive result, so the doctor will suggest us to take for the chest x-ray or the CT scan to observe whether there are any changes in your lungs or not. He will also observe your mucus or the sputum or the mucus which will coming during whenever you will cough. So this is another pamphlet which is indicating that the Ministry of Health and Family Welfare, Government of India, decided one campaign to stop malpractices in the TB diagnosis. So what are the treatments which are used for the treating the TB? So for the latent TB, the doctor will give you the medications which will kill the bacteria. Especially these are the antibiotics. And the second type of a TB, that is active TB, the doctor will use the combination of a medication. So almost all the treatment is based on these medicines. And if the symptoms are severe or if there are concern about infecting others, then hospitalization will also be required. And it is important to finish taking all your medications even if we will feel better after starting them earlier. So what are the risks that we can, there is a increased risk to get the TB. The first is, if your friend or coworker or family member has an active TB, or if you are living or traveling to the area where TB is a very common, such as Russia, East Europe, etc., or if you are a part of a group in which TB is more likely to spread, or if you are working or living in the hospital or the nursing home, or you are a health care worker for the patients at a high risk of a TB, or if you are a smoker, so definitely there is a more chance for you to get this disease. So what are the complications? If our immune system is healthy, then we can fight with this TB. But the patient who are already suffering from any other diseases such as the HIV, diabetes, or the head and neck cancer like diseases, so they will become more prone to this disease, or there will be the more complications in their body. And generally the babies or the young children are more susceptible to this disease. Now, how we can prevent? So, especially if you are having a active TB, then take the medications under the guidance of the doctor. And obviously, if you are suffering from the TB, then limit your contact with the others. Even also avoid the getting close contact or spending a lot of time to the loved one. Even the currently the bacilli calmette-guerin, this vaccine is available in the market for the small children, but it not means that if you are taking this vaccine, then in future you will not get TB. Nowadays, this mycobacterium has shown or get adapted to this hospitalized environment, and it is nowadays become resistant to the medicines which are taken by the patient who are having the TB. And it is developing its new strains which are resistant to that drugs. and that strains are called as a drug resistant TB. In case of a drug resistant TB, there are the two main variations. One is a multi drug resistant TB, that is MDR TB, and the second is the extensively drug resistant TB, that is XDR TB. Now, MDR TB is a form of a TB which is caused by the bacteria which will not respond to the first line medicines, that is isoniazid and the rifampicin, and it is also treatable and curable by using the second line drugs. And the second type of a TB is a extensively drug resistant TB, which is caused by the bacteria which will not respond to the most effective second line drugs against the TB. And the second line drugs are the amikacin, capdiomycin, kanamycin. And so if the patient is suffering from that XDR TB, then such a patients are diagnosed using a WHO rapid diagnostic like test, that is a cartridge based nucleic acid amplification test, or line probe assay, or through NAT. This is a chart which will show that how this bacteria is adapting to become more and more drug resistant. So the high percentage of our TB patients are infected with the TB strain which are resistant to both the isoniazid and rifampicin. So there will be the transmission of a drug resistant TB to the healthcare workers, and subsequent infection is likely to occur. So there was a small trial was undertaken to test the safety and efficacy of few other oral drugs against the extensively drug resistant TB and multi drug resistant TB. And the trial tested the three oral drugs, that is bedaquiline, pretomanid, and linezolid in the patient who are already suffering from the XDR TB and the MDR TB. Hope so in the future this bacteria will get eliminated, or this disease will get eliminated from our country or from over the globe, so that we can live the healthy life. So I hope that you have understand this little bit very interesting and very important topic related to the health. Thank you so much for the patient listening.